Welcome back to our channel, your one-stop destination for all things health. We're committed to bringing you accurate, practical, and insightful information to help you live your best life. Our logo, as you can see, is a symbol of our commitment to helping you navigate the complex world of health and wellness. It's not just a logo, it's our promise to be your trusted guide in your journey towards better health. Today, we're going to tackle a topic that often gets overlooked: oral health. But before we dive in, remember to hit the subscribe button and notification bell so you never miss out on our informative videos. Now let's get started and explore some common oral bad habits that could be jeopardizing your dental health. Hello everyone, we're diving into the world of oral health today, focusing on some habits that can seriously harm your teeth and gums. We often engage in certain practices, many a time unknowingly, that can lead to significant dental problems down the line. They may seem harmless, even mundane, but these oral bad habits can have severe consequences. Today, we're going to shed light on 10 such common habits, each carrying the potential to damage your oral health. From seemingly innocent habits like sucking on ice or chewing pencils to more concerning ones like tobacco use and not wearing a mouthguard during sports, we'll take you on a journey of discovery and awareness. It's time to rethink and reassess our daily routines to ensure we're not unintentionally harming ourselves. So buckle up and prepare to gain insights into these everyday habits that might be wreaking havoc on your oral health. Stay tuned as we unveil these habits one by one. Kicking off the list, our first two culprits are sucking on ice and not wearing a mouthguard. Now you might be thinking, what's the harm in enjoying a frosty cube now and then, or I'm careful when I play sports, do I really need a mouthguard? Well, let's dive into why these seemingly harmless habits could be wreaking havoc on your pearly whites. First up, sucking on ice. It's a common habit, especially during hot summer months or while sipping a chilled drink. But did you know that it could lead to some serious dental issues? The hardness of ice can cause microscopic fractures in the surface of your teeth, which can lead to larger dental problems over time. The extreme cold can also irritate the soft tissue inside your teeth, causing toothaches and sensitivity. It might seem like a refreshing habit, but it's one that could chip away at your dental health. Now let's chat about mouthguards. Often overlooked, these protective pieces of gear are vital during sports or physical activities. Whether you're a weekend warrior on the basketball court or a pro athlete, a mouthguard is your teeth's best defense against injury. Without it, you're risking chipped or broken teeth, damaged orthodontic appliances, or even jaw injuries. It's not just about protecting your smile, it's about protecting your overall health. Both of these habits, sucking on ice and neglecting a mouthguard, can seem innocuous, but they have the potential to cause significant damage to your teeth. The good news? They're easily avoidable. Instead of sucking on ice, try sipping on a chilled drink or munching on something less hard, like a cold grape. As for sports, always make sure to wear a mouthguard, even during practices. Remember, it's better to sip a chilled drink than to suck on ice, and never skip the mouthguard while playing sports. Prevention is always better than cure, especially when it comes to your oral health. Stay tuned for more oral bad habits that you should avoid to keep your smile bright and healthy. Next in line, we have bedtime feeds and tongue piercing. Diving into the world of bedtime feeds, it's common for parents to give babies a bottle to soothe them into sleep. But did you know that this seemingly harmless habit can lead to tooth decay? When babies fall asleep with a bottle, the milk, juice, or formula they're sipping on pools around their teeth. These liquids are laden with sugars which, when left on the teeth for extended periods, can cause decay and cavities. This condition, known as baby bottle tooth decay, can lead to pain, infection, and even loss of teeth. To keep your baby's smile healthy, aim to phase out bedtime feeds once they start teething. Instead, help them get to sleep with a pacifier or a comforting lullaby. Now let's shift gears and talk about tongue piercings. They might be a popular form of self-expression, but they also come with a host of potential problems. For starters, your mouth is a breeding ground for bacteria, making it easy for infections to take hold around a new piercing. Moreover, the jewelry can cause complications of its own. It may chip or crack your teeth, particularly if you have a habit of clicking or biting it. It could also cause injuries to your gums, or interfere with normal oral functions like speaking, eating, or swallowing. Worst case scenario, a poorly placed piercing can damage important nerves, leading to long-term issues. So, before you decide to get that tongue piercing, it's crucial to weigh the risks against the aesthetic appeal. Talk to a healthcare professional, consider all the potential complications, and then make an informed decision. In conclusion, while bedtime feeds and tongue piercings might seem unrelated, they both have the potential to harm your oral health. So, avoid bedtime feeds once your baby has teeth, and think twice before getting that tongue piercing. Remember, a little caution now can save you from a lot of pain later. Moving forward, our next habits are grinding teeth and excessive use of cough drops and breath mints. Now let's talk about grinding teeth. It's a common habit for many, often occurring unconsciously during sleep or in stressful situations. However, this seemingly harmless habit can have serious implications. Over time, grinding, or bruxism as it's medically known, can lead to a range of issues from jaw pain and headaches to severe tooth wear and damage. In some cases, the persistent grinding can wear teeth down to stumps. When this happens, bridges, crowns, root canals, implants, partial dentures, and even complete dentures may be needed. Not to mention, the chronic grinding can result in a fracturing, loosening, or loss of teeth. The intense pressure may also affect your jaws, leading to hearing loss, or worsen TMJ disorders of the temporomandibular joint. Next, let's consider cough drops and breath mints. They seem like a quick fix for a sore throat or bad breath, right? But here's the catch. Many of these products, especially those that contain sugar, can be harmful to your teeth. When you suck on a cough drop or mint, you're essentially bathing your teeth in sugar. This creates a perfect environment for cavity-causing bacteria to thrive. Continuous exposure to sugar can lead to tooth decay and cavities. Not to mention, the hard consistency of these products can also pose a risk of chipping or breaking your teeth if you accidentally bite down on them. So, what can you do to mitigate these risks? For teeth grinding, seek professional help. Dentists can provide solutions like mouth guards or recommend stress management techniques. As for the cough drops and breath mints, there are plenty of sugar-free alternatives available. Remember, these habits might seem insignificant, but they can lead to serious oral health issues if left unchecked. Try to manage stress to prevent teeth grinding, and opt for sugar-free alternatives when it comes to cough drops and mints. Finally, we have soft drinks, opening bottles with teeth, chewing pencils, and tobacco use. Let's begin with soft drinks. These fizzy temptations may quench your thirst, but they can wreak havoc on your oral health. Soft drinks are a double whammy for your teeth, being high in sugar, which fuels the bacteria that cause tooth decay, and having a high acidic content which erodes tooth enamel. Opting for water instead can significantly improve your dental health. Next, we have the habit of opening bottles with teeth. It might come across as a cool party trick, but this habit can be a one-way ticket to dental disaster. Our teeth are not designed to withstand such force. Using them as tools can lead to chipped, cracked, or even broken teeth, and the repair can be costly and painful. Chewing on pencils is another common habit, especially among students and individuals under stress. This habit not only wears down the teeth but can also cause them to shift, leading to misalignment. Besides, pencils are not exactly the cleanest objects around, introducing bacteria into your mouth. Lastly, we address tobacco use. Whether smoked or chewed, tobacco is a mortal enemy to your oral health. It can lead to a range of issues from tooth discoloration and bad breath to gum disease, loss of taste and smell, and even oral cancer. Each of these habits, though seemingly insignificant, can have profound effects on your oral health in the long run. The good news is, it's never too late to break a bad habit. The first step is always awareness, and you're already there. So remember, swap soft drinks with water, use a bottle opener, keep pencils away from your mouth, and avoid tobacco. It might take some effort, but your teeth will thank you for it. And as they say, a healthy smile is the best accessory you can wear. Swap soft drinks with water, use a bottle opener, keep pencils away from your mouth, and avoid tobacco for a healthy smile. Let's quickly recap what we've learned today. We've explored 10 oral bad habits, each with its own potential to harm your dental health. Sucking on ice, while seemingly harmless, can actually chip or crack your teeth. For those engaging in sports or physical activities, not wearing a mouth guard exposes your pearly whites to the risk of injury. Bedtime feeds for infants may lead to tooth decay, and tongue piercings can cause infections or chipped teeth. The habit of grinding your teeth, primarily during sleep, can wear them down over time. Cough drops and breath mints, despite their soothing and freshening effects, often contain sugar that can lead to cavities. The acid in soft drinks can erode tooth enamel, while opening bottles with your teeth, chewing pencils, and tobacco use can cause a range of oral issues from chipped teeth to oral cancer. Remember, your oral health is a reflection of your overall well-being. So, let's break these bad habits and keep those smiles bright and healthy.